So let's take a look at the anterior skull and identify some specific structures that can be seen. First of all, let's start with a few openings. These small openings are openings for blood vessels, and they're called foramens. This one is called the supraorbital foramen. This one here is called the infraorbital foramen, and this one is called the mental foramen. Now these three foramens are openings for what's called the trigeminal nerve, which feeds the facial muscles here, here, and here. This nerve extends through all three openings. In addition, there are blood vessels that extend through these three openings. You can actually take a finger, place it here on your own chin, and feel a pulse. Now these can also be observed on our view. On the anterior view, you can see this supraorbital foramen here, the infraorbital foramen here, and the mental foramen right here. We can also see some projections on the skull. One of these projections is inside the nasal cavity. These projections are called nasal concha, and they are bumps inside the nose that cause ridges for air so that when air passes through the nasal cavity, it becomes turbulent. It swirls around. This allows this air to be cleaned by this mucous membrane. So this one is called the middle nasal concha, and that is of the ethmoid bone, the same one that's in the eye, in the back portion of the eye. And then this lower one is called the inferior nasal concha. Other projections that we can identify here on this portion of the skull are the mandibular symphysis. It's a little point at the bottom portion of the skull. The mandibular symphysis can be seen here, the middle nasal concha, and the inferior nasal concha. Well, lastly, on the surface of the skull, we can see what's called the alveolar margins. These are places where the teeth are embedded. And they're given a specific name because of that unique characteristic where we have bone attached directly to another bone and fused in what we call a Gomphoses joint. This is a different kind of joint, a peg and socket sort of joint. So these alveolar margins are very specific for that kind of joint, and so they're given a special name. Here on the side of the skull, we can see what's called the zygomatic arch. Notice that I can place this probe right underneath the zygomatic arch. This is a place for blood vessels and nerves that feed the face to enter. This creates what you would consider to be your cheekbones. Well, we can identify the zygomatic arch just slightly on the anterior view. We can see the mandibular symphysis. We can also observe the alveolar margins. And lastly, we can also see the glabella, which is a place between the two eyebrows. Here is the glabella. Glabella actually means without hair, and this area is supposed to be without hair, at least in most people. Now let's proceed to the lateral view and identify a few more structures that we can observe. So from the lateral view, we can see some of the same structures we could see from the anterior view. We can see the mandibular symphysis. We can see the zygomatic arch. We can also see the infraorbital foramen, the supraorbital foramen, and the mental foramen. In addition, we can see some other structures. We can see these connections, articulations, to the temporal bone and to the zygomatic bone that create your jaw joint. So when the jaw opens, it opens like this. Notice that this joint, the posterior aspect, remains connected, whereas the anterior joint kind of stays loose. This is called the mandibular condyle, and this is called the cornoid process. The mandibular condyle stays within the groove on the temporal joint as you open up your jaw, as if you were like chewing gum. For some people, this groove does not allow the jaw to stay in place very well, and so they have a problem called TMJ, which stands for temporal mandibular joint. Because it slips out of place, it clicks from time to time. And so people can have surgery, they can wear mouth guards to try to help with this problem. Individuals with TMJ issues oftentimes can't chew gum very well, their jaw hurts, and it can even provide some pretty drastic headaches. Just posterior to the mandibular condyle is an opening for your ear called the external auditory meatus. Slightly inferior is a small projection called the styloid process. Kind of looks like a little earring for style, so styloid process. And then slightly posterior to that is something called the mastoid process. Back on the mandible, there's a solid part here called the mandibular ramus. And here is the angle of the mandible. The angle of the mandible is a location where we can identify a difference between a male and female skull. In a male skull, this is quite angular, 90-degree and wide. This portion is called the mandibular ramus. So let's identify these. So here we have our zygomatic arch, our mandibular ramus, our mandibular symphysis, of course, our angle of the mandible. This is our coronoid process, and our mandibular condyle. Here is the external auditory meatus, the styloid process, and the mastoid process. We could also observe the alveolar margins here if we needed to, the infraorbital foramen, supraorbital foramen, and right beneath this dot would of course be the mental foramen. Let's continue to the inferior view. Now remember that the inferior view does not have the mandible attached. So if I remove the mandible and look at the skull from this view, as you can see here, we can identify numerous new structures. Starting with the maxilla, there are two parts to this maxilla. You can see them color-coded here. This is called the horizontal plate, and this is called the palatine bone.
Ryan, Joe Mikowski, Nicole Langrick, Blake German, and Trevor Tannenbaum come to the middle school, high school guidance office, please.
Proceeding posteriorly towards the back of the skull, we have several smaller openings in the bottom of the skull. These are foramen for blood vessels and nerves. The largest of these openings is this one, called the foramen magnum. It's obvious right here. This is the opening through which our spinal cord penetrates. Now, because the spinal cord penetrates here, our vertebrae, which protect it, are found around it. So this portion of the skull, right here, is where we would find the first cervical vertebrae resting, or the skull would be resting on the first cervical vertebrae. You can see these rounded projections, which would allow the skull to rock back and forth on top of that vertebrae. These are called the occipital condyles. Condyles always means rounded projection. There's a small bump just posterior to the skull, right back here. This is called the external occipital protuberance. It can be seen in this model right here. You can feel this if you put your fingers at the base of your skull and move upward towards your hairline. There's a large knotted projection. We can also observe here the styloid process. We can usually see the external auditory meatus right here. And next to those we have two openings, here and here. These openings are observable also right here. These are called the jugular foramen and the carotid canal. Jugular foramen is an opening for your jugular vein, the largest blood vessel that takes blood away from the skull, away from your brain, through the skull to your heart. This is the carotid canal. This is an opening for the carotid artery, which is the largest blood vessel feeding the brain. All the blood that is traveling in this vessel through this opening is traveling to the brain from the heart. Lastly, we have this opening called the foramen lacerum. It's kind of a jagged edge, and blood and nerve also enter through this opening. The foramen lacerum can be seen here in this model, as well as the jugular foramen and the carotid canal. Remember, we can also see the other structures we observed from the lateral view, the mastoid process, the styloid process, the external auditory meatus, the zygomatic arch. Remember the others that we just learned, external occipital protuberance, foramen magnum, occipital condyles, foramen lacerum, jugular foramen, carotid canal. Palatine bone is here, horizontal plate. Hopefully this will wrap up all of the smaller structures that you need to observe on the skull. Please label them on your diagrams.